All right, so chin hold. As the table goes up, I can feel myself losing force, so I always find chin hold a little bit depressing because the higher the table gets, the less of me I have on top of the patient. And so you lose a bit of force. What you do gain is additional stability. If somebody has a really big head and you're having a hard time holding them, getting them up into your body makes a lot of sense. The chin hold really is much better for rotation. And so we're going to go back to doing the upslope technique or the primary leverage rotation, because once you get them up here, it's very easy to rotate their head. It's very hard to laterally flex their head because you have to use your trunk more so than your arms. And so I really think the chin hold, especially when you're first learning, is really primarily a rotational technique. And so very similar. So the contact hand is going to be the exact same. And so we're going to use the contact hand now on the left side so you guys get a little bit different view. Thumb is going to be on the mandible, anterior lateral aspect, straight wrist, forearm is adducted. But now with the opposite hand, as opposed to being here, we're going to go down and we're going to get Jess here. We're going to bring the apex of her head into our deltopectoral region, 2 fingers around the chin, and the forearm is going to be behind the ear. Understand the importance that the forearm is going to create rotation, right? To do so, it has to be on the posterior aspect of the axis of rotation. So don't put it over the ear. All you're going to be able to do is squeeze her. You need to be back here so that when you do this, her head rotates. So the forearm is just posterior of the ear. So that's the hold, right? Check in with yourself by letting go of your left arm. Do you have her? Do you have her comfortably in this position where you don't require your left arm? You should. If you don't, you need to actually load a little more and lean into her a little bit. And so again, back in this position, that's going to be your setup. Okay? It's all the same, right? Here she is in neutral. You're coming in, explore rotation. She has a ton. Come on back out. Put a little bit of side bending on it. Now explore. She has much less. You want even less? Put a little bit of lateral shift. Now side bending, and then some rotation. And then to finish it off, it's just rotation in that direction. And back to center. Good. Those are the main ones. Guys, just get good at those, and you'll have a very nice skill set to start off with.